leadership. We have senior leaders here, a number of them are joining us online. The young people of Uganda need your leadership. They need your guidance. I know most of you are critical roles. The parents that listen to you every day, every Sunday, on radio, in the churches, guide them. Guide them so that they can also guide the children and take care of them very well. But also, most of you here are senior leaders in the churches. You have a number of religious leaders under your leadership. They need mentorship, they need guidance. Because these issues are real. Our young people are getting pregnant and we are seeing them. Our young people are getting married when they are young. We are seeing cases of violence. They are real. And so these religious leaders that we have across the country need to come up and speak about this issue and guide the nation, guide the children, and guide the parents so that we can have a clear direction. And the third element of the interfaith is about collaborations, us learning from each other. The last time, the first one we had in Jinja, we had over 12 different faith groups, and they were sharing what they have been doing from their faith perspective. And that helped so many others who were not doing anything to start work. The last year when we were here, we had eminence leaders from the different faith groups, and they shared their commitment, which is what some of the things that we're reviewing today. They made commitment here that they need to take actions. And so when we are here, when we converse, when we talk from it, we listen to government, we have Ministry of Health and Ministry of Education here, then we learn from each other and we can be able to take some action thereafter. So that is really what interfaith is about. But we are also guided by one principle. The principle is that this action needs to be taken from the faith-based perspective. And we appreciate that there are challenges of handling these issues from the scientific perspective or any other perspective. But from the faith perspective, the question is what can be done? And that is really why we think this interfaith engagement is critical. And so ever since we started in 2020, so far we have engaged about 250 religious leaders directly, but indirectly they could be over 500 across the country. And working with UNESCO, we customized a toolkit that was developed at the continental level for religious leaders. Reverend Everett was part of the team that reviewed it and made sure it was customized to Uganda. So this toolkit is what will be used to mentor the religious leaders across the country. So we can use it and it works for all the different faith groups. We already have it and we want to start working with it to do mentorship. And the mentorship is not going to be done by us, the partners. We also need a team of religious leaders who will be trained as the mentors to mentor their religious leaders so that we can keep it within the faith-based perspective. And UNESCO already trained about 80 religious leaders on how to use this tool, working together with the Ministry of Health, the Adolescent Health Unit. And I'm also happy to announce that when we joined the team at the African Union, we pushed for the interfaith approach because they were developing a guideline for engagement of religious and traditional leaders. We pushed for the interfaith approach and it was adopted. That guideline is in the final stages and it will soon be disseminated across Africa. So this practice that we have started here has also been adopted at international level. We just need to do more with it. It's a very good practice. Otherwise, I'm happy that 3 years later, we are continuing with this spirit as the Alliance and all the partners that work with the religious leaders at different levels on sexual reproductive health. I would like to assure you of our